Welcome back to Great Day. As many of you know, October is Breast Cancer Awareness Month. As we gear up for the annual campaign to increase awareness, it's important to remember that we're all in this together. That's a philosophy that Genesis Medical Group holds dear. They work closely with patients and their family to create a personalized treatment plan. The CEO and oncologist of Genesis Medical Group, Dr. David Ellent, joins us this morning. Good morning.
Good morning.
I just want to point out that you are an internal medicine doctor, medical oncology specialist. You did your fellowship at University of Texas MD Anderson Cancer Center, and you're heavily involved in drug research and development. I make that point just to give people an idea of the quality and level of doctors that you have at Genesis Medical Group. Explain what Genesis is, because it's a little bit different in how they treat people.
Genesis is a multi-specialty group. It's designed around the patient. It's designed to provide the best care for the patient. And we designed to make sure we have a lot of preventive care to make sure that things don't happen to the patients. That's the whole goal of Genesis.
Yeah, and you make things convenient. You have several locations, but in terms of breast cancer awareness, for example, one of the things that you want women to do is to keep in mind to get that well woman physical and breast exam yearly, because as we know, catching it early is key to survival, really.
Absolutely. 70% of breast cancer patients who die from breast cancer were the 20% that didn't do screening. So screening is paramount. Screening is absolutely important. At Genesis, we have probably one of the best technologies. We have a Prestige mammogram, which is not just 3D mammogram. It's the mammogram that has also sensory suite. It has ability for the woman to control the pressure, so she doesn't feel pain as much because she has control how much she can press. It's very important to be around the patients, to make the patients comfortable as possible.
I've heard women say before, I just don't want to know. Can you speak to the fact that putting it off is not going to make it go away?
Absolutely. The important things is to prevent. Important things is to prevent the chemotherapy. And if we diagnose it early, then chemotherapy doesn't need to be done. Then it could be just the surgery, maybe radiation, and the hormonal pill. Versus if it's late, then it's a chemotherapy. And the survival difference is incredible. Early stages of breast cancer, the survival is above 98%, versus when it's metastatic is around 22% survival.
Yeah. At what age should a woman get her first mammogram?
Recommendation varies, depends on the different organizations, but we recommend at the age of 40, unless they have family history. If the family history, then recommendations to do it earlier.
Yeah,
and again, it's very individual. It's very important for a woman to talk to the doctor, and we're here for that.
Yeah, and be aware of your own body. If you think something's going on, then go ahead and go in. We talk about the self-exams to do monthly, and a lot of women I know will say, I don't know what I'm really trying to feel. However, I also have friends who say once they felt something, it was unmistakable. If we're doing a self-exam and what is it that we're feeling that should really bring us in?
Any kind of masses, any kind of changes in the skin, any kind of anything that's different from before. If you worry about it, get it checked. It's important.
Yeah. One of the things I mentioned is that you all take a family approach. This is something that a woman doesn't have to go through alone. And as we know, an illness like that is something that involves friends and family. So how do you bring family members in and make them part of the process?
We always want to make sure that families are around. This is devastating disease. The disease that sucks out the energy out of a woman. So we want to make sure that the family is around. We want to make sure the daughters are around, because the daughters, believe me, are the most important component of this. And we want to make sure that, and more importantly, we are around. It's not just oncologists. It's also nurse practitioners. It's the nurses. It's the whole team approach that Genesis does, including the communication between the doctors, between oncologist, radiation oncologist, and breast surgeon. We are a team, and we are the protective wall around our patients.
Yeah. At the same time that we see so many people pass away from breast cancer today, we see more survivors today than ever before. And part of it is because of the technology we have today and the awareness that we have today. Dr. Ellent, thank you very much.
Thank you very much. It was a pleasure.
All right. For more information on Genesis Medical Group or to book an appointment, visit their website at genesisdoctors.com or call 281-440-5300. That's 281-440-5300. They can do your mammograms and any other health needs that you might need to be addressed.